Welcome to Health Matters on Channels Television. I'm Yomi Otaibe. On the show today, we'll be looking into how to prevent and control a condition that has been described as a silent taker of life. Hypertension is one of those medical conditions that do not show visible symptoms until it's almost too late. It cuts across gender and socioeconomic status. What are the causes and consequences of unchecked hypertension? And how can it be prevented and managed? That's the focus for today, and our guest on the show is a medical practitioner, health educator, and the executive director, Brain and Body Foundation, Dr. Dayo Ajibade. Good to have you here.
Thank you. It's good to be here.
Okay, we're talking hypertension, and of course we know hypertension is raised blood pressure.
Yes.
Different people have different ideas as to what causes hypertension, but as a medical practitioner, tell us, what do we say when we say hypertension? What will cause the blood pressure to be raised above normal?
That's a great question. Primarily, it's called, many people use the term essential hypertension, meaning that, well, we're not really sure what is causing it. We just know that over time, some people develop high blood pressure. And now, however, there are certain conditions that, of course, can make it worse. For instance, if the blood vessels over time get diseased, a condition known as atherosclerosis, when the arteries become hardened, because essentially the blood vessels should be pliable. They should be able to dilate when blood is flowing through, contract when they need to contract. Sometimes that control, which is, of course, from the brain and certain endocrine or hormones, sometimes that control is lost. It's not as effective as it should, and usually, again, that happens as you grow older. I mean, it's not a normal condition, but we tend to see it more in older people. Although in people of black skin, Africans, we begin to see hypertension at a younger age for some reasons that we may be able to discuss later on. So, in short answer to your question is that many times we're not really sure exactly what causes the hypertension, but we know that there are conditions that are associated with high blood pressure.
Perhaps that explains why some people will say, okay, it's as a result of stress. Mm-hmm. Some will say, okay, if you shout too much, you have hypertension.
Mm-hmm. Some say too much coffee drinking, for example, yeah.
So that means there is some kind of a lifestyle mm-hmm. that is involved in the possibility of having hypertension.
True. Your diet, your exercise or lack of, the environment, some of the things that you do and you don't do. So lifestyle too plays a part. But we're also beginning to see that your genes too play a part. Obviously, if your parents and hypertension runs in the family, there's a great chance you may have it. But also, we see along certain races. I mentioned black people because we begin to see that more and more, that we tend to have more of hypertension. And one of the reasons they point out is some genetic factors, actually, that are caused to it. And maybe we'll get to that later on.
Okay, so if lifestyle is there, some conditions, medical conditions, as you mentioned, and exercise or lack of it, what role will stress also play in hypertension?
Well, stress, which is primarily an emotional response in the brain, tends to release certain chemicals into the bloodstream, which tend, for the most part, to constrict or tighten the blood vessels. Stress also does several other things in the system. Even we now know that stress can actually make your platelets tend to clog together more, and platelets in the bloodstream, if they clog together, there's a greater chance of atherosclerosis and build-up and blockage of the blood vessels.
And talking about build-up, we have this slide on TV now, so we can see the progression.
Right.
So talk us through this.
Well, if you look at the first segment, you see that there's actually nothing at all. It's just a nice, clean, smooth lumen. The lumen is the inner lining of the blood vessel. That's how it should be. That's what a normal blood vessel should be like, a normal artery should be like. But over time, again with age and certain conditions, worse in sickle cell disease, for instance, is worse among sickle cell, you begin to see that with increase of stress, increase of different chemicals, sugar, high blood sugar, for instance, can begin to cause a gradual build-up. High cholesterol, exactly. High cholesterol can begin to cause a gradual build-up. You can see the yellow beginning to get thicker and thicker as we get to the third and the fourth segment. And the fifth segment from the left, you see that there's something basically erupting. And that sometimes the plaque can actually break off. What we're talking about now is plaque buildup. Can actually break off and cause what is called a thrombus and plug some smaller vessels, which would cause damage if it's in the heart, for instance, or in a heart attack or a stroke. What I want to point out is that that's the last segment. You can see that it's almost completely blocked. Cardiologists say that we can have at least up as much as 70% blockage, 70% blockage, and you wouldn't
70%.
You wouldn't feel a thing. You'll be walking and breathing normally, no problem whatsoever. But that remaining 30% could happen, could get blocked just like that. So we don't want to say, well, let's wait until it's 70%.
It's that 70%.
Then we're going to start doing something about it.
Let's talk about, before we talk about the screening, salt, high salt intake has also been mentioned.
Right.
And where do we, or how do we draw the line between high salt intake and, you know, the normal salt that we need in the body?
Well, the general advice, and again, this happens more in black, we tend to be more salt. Our hypertension is more salt dependent. So the advice is don't add more table salt to your food.
Hypertension is more salt dependent.
That's what the findings say.
So we all need to watch how much salt that we take in.
Exactly.
What does it do in all of this? Is it that it's going to block some? We know that cholesterol, high fatty food, okay, could be clog up that artery that we saw earlier.
Right.
So what does salt do?
There's a complex system that operates with the brain, the kidneys, and the blood vessels. And it's called the renin-angiotensin system, and the aldosterone system. So to cut a long story short, salt tends to attract more volume to the blood vessels. So salt makes the volume of blood passing through more bulky. And if the blood is bulky and you have a narrow passage to which you're passing through, it can actually begin to cause damage to the inner lining of the blood vessels and can cause what they call hypertension in certain cases. It's a lot more complex than that. But
okay, let me just remind our viewers that you can actually join us in the discussion by calling 080-8054-2233. That is 080-8054-2233. And of course, send your tweet to CTV@_Yomi. Now, let's talk about the screening. Because I have seen a man, it was during some community medical screening. You know, it was just normal. It was just looking okay. But by the time the blood pressure is checked, it has about 200 and, you know, something over 160.
Wow. Wow.
And the medical personnel were all over the place like it's an emergency. And the man is just looking, what's going on here?
What's the fuss about, right?
So tell us what the normal range is and, you know, when it is going overboard.
Normal range really is 140 over 90. And this story that you just mentioned is all too common. I know a Professor Anuma in Abuja. She goes to schools, not just communities, but primary and secondary schools, to check their blood pressure and blood sugar. And 50% of the time, at least, 50% of the time, she finds out that these kids, we're talking about kids now, they're teenagers, having high blood pressure. She checks the teachers. It's over 70% of the time they have either high blood pressure or high sugar or both. And so there's an outcry really that we need, I think we tend to be a little bit more complacent, we Nigerians, but we need to
perhaps because it doesn't really give you that sign.
A warning sign.
You know, the early stages. You just go about thinking that everything is good.
Yeah.
So it is very important to go for screening.
Absolutely, absolutely. One of the things I recommend when I do talks to groups is that any organization, you really should have a blood pressure measurement since we're prone to having hypertension, people should be able to just walk up to a certain office there, say, I want to check my blood pressure, and just check it just to make sure. And then they need to go see the doctor. Once, 2-3 times it's shown that your blood pressure is over 140 over 90.
Yes, because I was going to say, sometimes maybe because of the situation,
right,
your blood pressure may go up at that particular
times,
time.
Yeah, stress and
so
all that.
When will it be classified as, hypertension?
The standard answer is that you need to take it three or four different times over a period of months, weeks to a month, a couple of months, to ascertain for sure that your blood pressure, that you really have hypertension, because as you said, it could be a transient thing. One of the findings we know is that blood pressure seems to be highest upon rising, highest levels of blood pressure. So if you take your blood pressure in the morning, this week, next week, third week, and it's high, there's a pretty good chance you have hypertension and you need to be on medications. And once you go on medication, and this is another problem I see, people feel, well, I know when my blood pressure is getting high because I get a headache or I feel a little dizzy, so I know when to take my medication. Absolutely not. You need to take your medication as your doctor has prescribed it. And if you feel that, well, things are getting better, you need to go with your doctor and you work with your doctor to taper it down. If you feel, well, I'm exercising more, I've lost weight, so hopefully my blood pressure should be better controlled. Yes, but you cannot do it on your own. And I see too much of the time, like I said, people just seem to want to just take it into their own hands. They take some supplement and they're like, okay, I'm better now. I don't need my medication anymore. That's wrong.
So it's not something that you can just say, because I feel better now, I don't have to take the medication.
Absolutely, that's
again.
a mistake.